Good morning. Very good morning to all of you. Today we are going to discuss the case note of CHERYL Cook. She's diagnosed with laryngitis, and now we are writing a letter of referral to Dr. Tim Richards, who is an ENT specialist, to assess the polyps or the nodules she has. So this is what the case note is about. The writing task is a referral letter to Dr. Tim Richards. So from the case, it's understood that he is an ENT specialist, and the purpose of referral is to get an expert evaluation and opinion on the polyps. So this is what the thing. Now let's go ahead and see what the problems are with the CHERYL Cook. So we got the date of birth, admission date, discharge date, and the diagnosis as laryngitis. Now we have to see the patient history. The main history is hoarseness, sore throat, dry cough, voice loss, and this all was lasting for 18 days. And this is her history, and she takes 30 units of alcohol a day and 5 units smokes, 5 cigarettes she smokes. And she has a frequent history of upper respiratory tract infection and has hypothyroidism since 2005, which is controlled by thyroxine. Now, she had a mild asthma. Now it's well controlled and no major attacks for 4 years. Now she came to the hospital with her husband, and the presenting complaints are here. So those things we have seen. As we have seen that, we move further. His husband's name is Christopher. 2 children cross the toddler age. They are in the preschool and school age. Now, her profession, something very important here is that her profession, she works as a jazz singer in a loud busy bar. Now she has a concert next month and worried about the possibility of not being to keep singing, as she has the problem of this laryngitis. Now she had underwent laryngoscopy, and we have found that some polyps or nodules are there. Right now, as a first line treatment, so at the nursing management or the medical management was giving strepsils, that's lozenges, and corticosteroids, and that's specifically prednisolone inhaler every 6 hours. And she was given water every hour, frequent intake of water to soothe the throat. Now, this is what we have seen as a management. After management, we have given her some advices, and that's what we can see here. We have to, we told her to avoid these types of habits and to continue the prednisolone for another 6 days. We started today. For another 6 days she needs, and she needs to, we requested her to give rest to her throat, avoid singing, avoid clearing throat, avoid whispering, avoid oppressed, avoid infections. All these things we have said to the patient, and we also said her to drink plenty of water and to take inhaler inhalations every 5 minutes. All these things, humidifier, all these things we have said. One most important thing that we have told as a part of your discharge is to stop bar working, to which the patient has not responded positively. So this is what the whole history is. So we are writing letter to Dr. Tim Richards, and this is the only purpose that we are writing to Dr. Tim Richards, and this is his area. These areas are not related to Dr. Tim Richards. He just need to see this, and in case of any further problems, we we need to advise her to seek medical attention as soon as possible. So let's go ahead with the letter we have written today's date, because there is a confusion in the case note, because we have got the case note as discharged. So a point, it can be written at any point after this 9th. So even on the 9th, we can write. So I have not given the date. It's not clear. That's why it's unclear. That's why, because most of your OET letters, you'll be having the date, today's date. So don't worry. You don't get confused there. Dr. Tim Richards, I can say ENT specialist. That's better. So I can go ahead with that. ENT specialist. 28 Acacia Ave, Vauxhall. Okay, now Dr. Richards. Dear Dr. Richards, this is referred regarding CHERYL Cook, and her date of birth is 1970, 2nd October. Now, what's the purpose of this letter? I'm writing to refer Mrs. CHERYL Cook, who has been diagnosed with laryngitis. She requires your specialized assessment and further management, since she also has vocal cord polyps. So she does have laryngitis. This is the primary problem, and I'm writing this letter of referral to you just because she needs an expert evaluation and appropriate care regarding her vocal polyps, which we found in the laryngoscopy. So this is the purpose of the letter. Okay, so we don't have the discharge date relevant here, because we are just writing a referral letter here. That's why I have not written the discharge date. Now let's go ahead with the first particular paragraph. Mrs. Cook presented to our care with complaints of hoarseness, sore throat, dry cough, and loss of voice, which she reported persisting for the last 18 days. So we have the presenting complaints listed down in the first particular sentence. So we have said that she has hoarseness, sore throat, dry cough, and loss of voice. And she reported that this condition was persisting for the last 18 days. Now, subsequently, she underwent a laryngoscopy, which revealed the presence of nodules on her vocal cord. So we have vocal cord nodules there, and therefore she was commenced on prednisolone for a week. That's 7 days. So you don't need to write another time, and was advised to take lozenges every 4 hours and as required. So the matter is complete. The the medical management, that's prednisolone for a week, that's for 7 days, and lozenges every 4 hours and whenever required. She was also educated regarding the ways to recover from conditions such as giving complete rest to her throat, gargling, hot water inhalation, and drinking plenty of water. So these all things you can see in the discharge plan. So we have given her advice, and we have given health education for her. We have advised her to stop stop her work too. So I can add that particular thing here if you want. That's something relevant here. you can say that we advised her to stop the work. We can say that she didn't respond to it positively. So if you want, you can add, but you need to place it in the correct position. Now let's go ahead, because we have to say if you want to say that advice, before that you have to say who she is. So she is a jazz singer in the bar. That's what we have to say. Then only we can say we advise her to stop the job. So before that I can now do that. So that's a problem there. If I want to say that she was given advice to stop her job, before that I have to say what her profession is. Her profession is a jazz singer at a loud busy bar and consumes 30 units of alcohol a day. She's also a smoker. She has a history of frequent respiratory infections and has been suffering from asthma, which is well controlled at present. She's also taking thyroxine for hypothyroidism. So these are the social history, professional history, habits, and the past medical history. Now, what you are supposed to do is that it would be appreciated if you could evaluate Mrs. Cook and manage her condition in the best possible manner, which you feel the most appropriate. So, well, how do you feel the most appropriate? The best possible way you can manage. So, you have to have an expert evaluation on her condition. If you have any further queries, please do not hesitate to contact me. You are sincerely, because you have seen the name of the doctor, Dr. Richards, nurse. So we have said these things in brief. So that's it. This is the complete picture of the letter. Have a nice day. Thank you.